Medical help is on its way to India as the country has set a global record for new infections for the fifth straight day. The European Union and United States are sending equipment like ventilators and raw materials needed for vaccines. On the ground, the situation is critical. Hospital beds are scarce, morgues are full, and the oxygen that is needed to save people's lives is in short supply.
Grief outside hospitals in Delhi. Disinfecting the dead. The fear of infection remains even when life has passed. Makeshift cremation sites like these are springing up to deal with the rising death toll, because crematoriums and cemeteries cannot cope. Relatives feel helpless as the coronavirus tears through the capital.
I have money, I have everything, but I can't save my sister. Because no bed, nothing like that. No gas, no oxygen, no bed. Where we can do, where we can go.
As overwhelmed hospitals have run out of oxygen and intensive care beds, India's Prime Minister urged patience and caution. I'm speaking to you on this radio show at a time when corona is testing our patience and our capacity to bear pain. Many of our loved ones have left us too soon. At this moment, in order to win this battle, we must listen to scientists. For several days running, the Indian government has reported more than 300,000 new infections. Doctors worry the recent surge has been fueled by a new variant, this one composed of two other more infectious and vaccine-resistant versions of the virus. Health experts fear the result could be a virus that's faster spreading and less controllable. Several countries have offered help. India's Air Force collected oxygen imports from Singapore on the weekend. And the US and the EU are planning to send aid. EU President Ursula von der Leyen says the bloc is pooling resources to respond to India's request for assistance. But for the sick queuing outside full hospitals in Delhi, these supplies can't come fast enough.
And we're going over to Delhi now, where DW correspondent Nimisha Jaiswal is standing by. Hi, Nimisha. So how quickly is international help coming in?
Well, Christine, India put out an appeal for international help late last week, and the response has been significant. Already there has been support from Singapore that has been flown in. More is expected through the course of this week. The UAE, Saudi Arabia, even Pakistan and China have come in with offers of support. We also have the EU. Germany has made a statement that it will ensure that any bottlenecks in the supply chain for vaccine manufacturing are resolved quickly, because India's supply actually impacts the global supply of vaccines as well. The US invited criticism over the last couple of weeks for restricting the supply of raw materials that have been crucial for production in India, saying that it actually requires them for domestic production. But now both President Joe Biden and Vice President Kamala Harris have made statements that the US will stand by India and also expedite the production, the delivery of these raw materials, much like India stood by the US during its surge in cases.
Yeah, and the coronavirus cases have hit a global record peak for a fifth straight day. The number is 353,000. I'll just point out that that's well over 300,000 more cases than the next highest country. But even then, Nimisha, it's being said that the government is underreporting the number of cases and deaths.
Well, Christine, most of the evidence around this is still anecdotal, but it is definitely a concern. Now, already local journalists have put out reports saying that the COVID protocol cremations they're seeing in their towns and cities are far above the reported numbers. One major international newspaper reported that the numbers may be 10 times as high as the death toll India is reporting. In addition, India's positivity rate is very high, which also means that the prevalence of the disease is very high. In the national capital, it's above 30%. But all of this comes at a time when the Indian government asked Twitter to take down tweets critical of its handling of the pandemic. So a free flow of information may be hard to expect.
India is said to be launching a larger rollout of its vaccination campaign. That's later this week. Will vaccines be quickly available for everybody?
This larger rollout of vaccines, Christine, is for everybody above the age of 18. So this is going to be a massive demand. Already some steps have been taken to increase output. The approval of other foreign vaccines has been ramped up. Already Russia's Sputnik has been approved. In addition, the government has made advance payments to major manufacturers in India, especially those of the Oxford AstraZeneca vaccine. However, there are concerns about a high price point for these vaccines, given that the states and private hospitals will now have to buy these vaccines at a higher price from manufacturers. And this may actually affect and impact the access that many of India's poor may have to these vaccinations. However, also important to note that half the vaccines being given out will be given out by the central government for free.
All right, that's Nimisha Jaiswal reporting for us from Delhi. Thank you, Nimisha. And for more, I am joined now by Dr. Anant Ban, a researcher in bioethics and global health policy in Bhopal, India. Good to have you on the program, Doctor. Just last month, the health minister said that India was in the, quote, end game of the pandemic. Today, the country is hitting global records in infections. What's gone wrong in your view? You recently tweeted that new variants and mutations were not the cause.
Yeah, thank you for having me. So when I put in that tweet, what I meant was that, of course, variants and mutations could be a driver in many ways. But what one has to recognize is that the fundamental reason we might be seeing an increase is that perhaps we took it easy too soon. And this virus has taught us globally that there is always a chance of a resurgence in infections, and we need to be extra cautious and ensure that we are following public health precautions. And that sometimes I felt was not being adhered to, and the public health messaging was probably getting too lax, and policymakers were not taking this too seriously. So there were mass congregations happening, election rallies happening, and just a lack of adherence to the corona norms, which could have been a major driver.
Dr. Ban, as we've been reporting, coronavirus cases have hit a global record peak for the fifth day, 353,000. And I just want to point out that that's well over 300,000 more cases than the next highest country. But even then, it's being said that the government is underreporting the number of cases and deaths.
Yeah, there have been a lot of concerns raised around the fact that not adequate and correct tabulation of both cases and deaths is happening in the current situation, and that is being validated by reports from anywhere from cremation grounds to mortuaries, etc., where official data seems to be much lesser. Now, this could also be a vestige of the fact that even historically, before the pandemic, not all deaths in India were correctly being tabulated,
Right.
and that obviously is being reinforced now. But it's extremely important for us to know what the correct data is, and that can help drive the policy response. So hopefully we'll do a better job of tabulating the true impact of the pandemic.
And the international help that's coming in, Dr. Ban, is it going to be enough to reverse the curve now?
Well, one hopes it will significantly contribute. India has been very kind to the global community over the last year or more in terms of sharing its expertise, its vaccines, etc. And I think, as we have learned from the pandemic over the past many months, we are all in this together. And this is a time for global solidarity. India is unfortunately facing the brunt at this period of time, but we are all protected by helping each other out. And this time, India certainly needs the help, all the help it can.
All right, that's Dr. Anant Ban, bioethics and global health expert, talking to us from Bhopal, India. Thank you, Dr. Ban. And here's a look at some other developments in the pandemic. Bangkok has extended its coronavirus restrictions as it deals with a new outbreak. Parks, gyms, cinemas and daycare centres have been ordered to shut. Hong Kong and Singapore have confirmed they're launching a travel bubble in May. Travellers will be allowed to fly between the cities without going into quarantine once they meet strict conditions. And Israel's health ministry says it's examining whether cases of heart inflammation are linked to the BioNTech Pfizer vaccine. Most were reported in men under the age of 30.